So the first part of the discussion usually is about weight loss. So we talked about the synthetic injections, which would be Ozempic, semaglutide, tirzepatide, all those. And we talked about a big problem with them, and that 40% of the weight being lost is from muscle, not fat, and why that's so important. And I know even in your dental discussions, you've talked about this before too, because everything's connected. I mean, it's the whole concept of holistic health. But muscle is connected to so much more than people think, even brain health. I mean, losing muscle, we already lose muscle each year once we turn about 30. We lose it's very difficult to maintain and build lean muscle, even if you're really trying. So yes, there are ways that you can offset losing a lot of muscle when you're on the injections, but it's very, very difficult, near impossible for most people to intake the amount of protein every day and to work out in the gym or lift the amount of weights that you need to offset losing that amount of muscle. So if you want to set yourself up, I sort of look at it as financially, the time to talk about retirement is not when you are going to retire that year, right? It's you have to think about these things early on. And with our bodies, there's nothing more important than setting ourselves up properly well in advance so that we age gracefully, so that we age healthy in a way that allows us to be active with our grandkids, to not have aches and pains, because unfortunately too many people think it's normal to have aches and pains as you age. I know you don't, because you're out dancing. I mean, you've become pretty much a competitive dancer now.
I guess so. I don't know. I'm a dancer, and I just play a dentist on TV. That's my side job, but not. Sometimes I feel that way, but it's so fun. It's definitely fun. But yeah, I mean, if I'm not doing anything or keeping myself healthy, when I start to go back to dance, because dancing, it ends up being in Baton Rouge, it's kind of cyclic because we have the events, and then you have some times that you're not dancing, and then so when I go back, it's like, oh gosh, before I was kind of like, I'm having this joint pain in my hip. I guess I'm 50. Then I was like, no, I'm not. This is not normal. It doesn't have to be normal.
It doesn't have to be normal.
So we can we can have longevity, but also longevity with our mind and our bodies, and be able to be healthy. Like you said, but dementia and Alzheimer's is besides cancer, those, I always say that, are probably some of the worst ones that you have to deal with family members, or God forbid yourself. And we can pretty much pinpoint that there's some things that we can do that can combat that. There is some genetic factors, but you can still fight against that and a lot of other diseases if you're healthy from the beginning, like starting early. And early, I mean like by 50 or 60. That's still earlier than waiting, but the earlier you start, the better. Like I have my kids on this.
There's never better time to start than now. That's right.
That's very good.
Other than yesterday or the day before that, now is the best time. I mean, we have teenagers taking this, and it's not just. So we talked about weight loss, and you touched on some of the other opportunities to have optimal health in your body through bioactive precision peptides. But I will also say that bioactive precision peptides is a very unique term that only Make Wellness promotes, because this is a trademark term, actually trademarked by the company Make Wellness. And if you want me to tell you how Make Wellness came about, the founders of the company went on a global search for holistic health. And this is a really cool story because they found this lab in Ireland. And you've already alluded to the fact that in the United States, we were allowing poison pretty much in our foods. We were allowing in high fructose corn syrup and all of the red dye. And we know, I mean, I've been prescribed medication for my babies that turned out to be carcinogenic. I was furious and I was hesitant, but I trusted. And look, I know that when we know better, we do better.
Right.
But we know
you
better.
Only know what you know sometimes.
When we know better, we do better. And we have to pay close attention to who's funding the trials, if there is trials, if it's been around long enough. And so to have all natural ingredients, we actually have a clean slate ingredient list that shows what we make a promise to never include these ingredients. We are a totally clean company.
Cool.
But to have that foundational value, but also the clinical trials, 10 years of double-blind third-party human clinical trials to prove that these actually work.
Yeah, you don't have to have crap in something to
that
make it work.
That is true.
It actually works better when your body can take it in and use it instead of taking it and putting some of it out of there because it's
Correct.
just trash.
Correct.
Yeah.
So the founders of
That's
this
exciting.
company, they went on a search for just that. And they knew the value of peptides and that they were really on trend in the United States and really globally. And so they've discovered this lab in Ireland called Nuritas, Nuritas. If you want to look it up, Nuritas.com, fascinating. And I actually had the privilege of being on a video conference with Dr. Nora Caldi, the founder and CEO of that company. And what they do is they have this very high level AI technology. They're using artificial intelligence to identify and isolate these peptides, bioactive peptides in nature. So I mentioned that we're the only ones who have bioactive precision peptides. Bioactive peptides in general have been around way longer than us. They're basically just peptides in nature that have been around longer than humans. They are in plants and in the foods that we eat. For decades, we've been hearing holistic practitioners talk about how the answers to what ails you are often found in plants,
your food,
in foods. They're meant to nourish your body. And so they found this lab in Ireland, Nuritas, that's using artificial intelligence to find it's not like we invented peptides, but the challenge has been figuring out which peptides of the trillions that exist could be not only used, but in certain formulas working together and extracted in very precise ways. They have to be extracted in a very precise way to not damage the peptide. And then which ones actually work. They target certain cells. It's not a blanket approach. They're they go directly to the cell that needs the message.
Yeah.
And then it takes time. And the older we are, the longer it takes for our cells to turn over. So in some cases, you do see effects pretty quickly, but I always give the disclaimer, give it 12 weeks. Especially if you're trying to lose weight. You're not going to lose 20 pounds in a week or two. More importantly about the weight loss, though, it's not about weight. It is about body composition.
Yes, absolutely.
I tell people, do not look at the scale. Give it 12 weeks. Do not look at the scale because you don't want to lose weight. You want to lose fat. And our clinical trials from that peptide product that helps people to lose weight, which people call nature's Ozempic. I'm not saying I call it that. I'm not making a reference that week. I'm just saying it has become a term.
Yeah.
It's a capsule and you take 2 in the morning and it's affordable. It's affordable. I think it's, $80, $89, something like that, and depending on a subscription, but it's affordable for people and it's something they can do on their own without a doctor's supervision. They don't have to cycle off and on. May take a tad bit longer, but if they are patient for 3 months, give it 3 months and get your body composition so that you can make sure you're losing fat and not muscle. And the studies show 6% weight loss, 100% of the weight that was lost was from fat. 0% was from muscle.
That's awesome.
0%. It's huge.
That is huge.
With that one peptide product in particular, it's called lean. So that's a very popular one. That's usually sort of the gateway into the bioactive peptides. But this company, Nuritas, when they met with the founders of our company, I heard our founders say this story face to face. I flew out to Arizona a year ago to meet with them. And one of our founders said, I'm sitting there meeting with this CEO, and she's a brilliant scientist, Dr. Nora Caldi. And he said, and I'm asking her, why does your YouTube page have like 14 followers? Like, this is amazing what you're doing. Why doesn't the world know about this? And so they really made it their mission to start marketing, to bring this to the United States. That's cool. To really find the people like me who are passionate about this and could really lay the foundation to help bioactive precision peptides become a household name. So that's kind of the story behind how it came to be. And we have an exclusive agreement with that lab, Nuritas. We have lots of labs with whom we partner, but that's the one that fascinates me the most. Yeah, and they also, their baby is PeptiStrong. So when you look at we have a product that increases muscle mass, not only maintains muscle mass, but helps you to increase muscle mass as you age. So you can start. I truly think that's the one everyone should take. It's a stick pack of powder.
It tastes so good.
It does. It's like a glass of orange juice or Tang. I'm sure my age now. If you remember, I don't know if Tang is still around. Is Tang still around?
I don't think so. I don't think you can get Tang. I don't know.
It's sort of like Tang. But you take Fit every day, and I know you. Don't you take it every day?
Yes, I actually mix the Fit and the Hydrate together.
I do too. So, I mix a lot. Actually, right now I'm drinking Energized and I'm drinking Fit and I'm drinking Fit and Hydrated together right now.
They're really good. We've got a lot. So you kind of introduced it. Yeah, you introduced it to me through the partner that we're doing the other peptides with. It was kind of an interesting little thing. It's like, hey, check this out too. And it was perfect because I got into the other peptides because of my son Spencer as a trainer, and we were training and they had all this knowledge, and I was like, this is amazing. People need to know this. And then, but it's expensive and it's an injection and you have to have a doctor. So we had to do a lot of research. Like, how can we do, I'm a dentist. How am I going to do this? How is this going to happen? But I know that the patients could really benefit from it.